One of the biggest medical mysteries about COVID-19 has been how some patients develop long haul or post-COVID, which can bring new and debilitating symptoms long after the first acute infection.
According to several studies, about a third of COVID patients may be experiencing long-term symptoms. The good news is that more treatments are becoming available, and patients vaccinated against the virus are showing improvement. NewsCenter Maine's Vivian Lee has more in this report.
In early March of last year, Gretchen Drown's teenage son started getting symptoms of what seemed to be the stomach flu. He recovered within a couple of days. Gretchen had bouts of sneezing and a sore throat, but then other symptoms.
This was like muscles vibrating, and I thought, well, that's weird.
Then neurological issues started.
Symptoms started to kind of evolve. I would get worse stomach aches every day. I would take naps.
In April, Gretchen felt like she couldn't get enough air. After treatment for a possible bronchitis infection, another problem, an erratic heart rate.
It would speed up, beat too fast.
In the early days of the pandemic, COVID tests were only available for patients who traveled overseas. Finally, her doctor said she probably had COVID-19. A year and a half later, Gretchen is still suffering from debilitating symptoms. The Centers for Disease Control says long COVID or post-COVID symptoms may affect up to 23% of patients months after initial infection. Symptoms can include fatigue, breathlessness, headaches, muscle pain, and sleep problems. And there are currently no tests to diagnose long COVID. Scientists say in some cases, a long hauler's immune system can keep behaving as if it's still fighting an active infection, even long after the virus has left the body. And in those cases, their immune system can produce substances called cytokines. They're beneficial to fighting an active infection, but can cause widespread damage to the body. Tests showed high levels of cytokines, but left Gretchen's doctors with no answers on how to treat it.
There's a whole host of 200 plus symptoms.
Dr. Todd Kitchens is the director of the COVID Recovery Clinic at Central Maine Healthcare in Lewiston. He says treating long COVID is a challenge because the condition is still so new. The clinic has about 75 patients and uses different approaches such as diet, herbal and vitamin supplements to lower stress and support the immune system. Dr. Kitchens strongly recommends long-haul patients get vaccinated against COVID-19 first.
About half of those patients are seeing significant improvement in their symptoms, and some of them, their symptoms completely resolve.
As for Gretchen, who has been vaccinated, she is slowly improving in some areas. The artist and budding photographer has more stamina to do activities for longer periods of time, but she still experiences fevers and sore throats almost on a daily basis. She says more research is needed to help possibly several thousand Mainers left in limbo by a horrible disease. In Portland, Vivian Lee, NewsCenter, Maine.
The Maine CDC is currently collecting information from patients diagnosed with COVID-19 last year. The data is being used in an ongoing study into the long-term physical and mental consequences of the disease. For more information about the survey and long-haul COVID from the Maine CDC, just go to our website or mobile app.